Middlesex, London.
Thank you very much, Mr. Speaker. Speaker, my questions to the Minister of Health and Long-Term Care. Speaker, this morning we've witnessed another example of how this government uses studies and committees to delay and ration health care. Aidan, we've heard about a healthy young high schooler has degenerative eye disease, and if left untreated, he'll legally go blind. When Aidan's parents met with ophthalmologists to review his options, they were told there is hope. There is a surgery that is available that can save Aidan's eyesight, but OHIP doesn't cover it. Speaker, other provinces have studied the scientific evidence backing this procedure and are covering it. Why is the minister using more of the precious health care dollars to study it further when that money could actually go to the procedure and give this child his eyesight? Will the minister act and give this child his procedure?
Well, Mr. Speaker, it's because we're following the advice of the Ontario Health Technology Advisory Committee. We didn't make a political decision. I didn't make a decision on whether or not to fund this. We followed the advice of our scientific and clinical evidence-based experts who told us that we should, on a pilot basis, an experimental basis, that we should fund in a limited fashion this procedure, which is one of a number of options that's available for individuals with particular medical conditions. And so on that basis, following the direction of the advisory committee, which I would hope that members of this legislature would agree is an appropriate approach to take for corneal cross-link surgery and, quite frankly, anything we do in health care. But on that basis, we funded a conditional, limited pilot program specifically for patients with progressive corneal thinning disorders. We funded that through the Kensington Eye Clinic. We continue to fund that. We've quadrupled the funding, Mr. Speaker, and we're close to seeing the results of that pilot.
Thank you. Supplementary.
Thank you, Speaker. Back to the minister. Speaker, I don't think there's any common sense left in this government. Every other province has looked at this procedure, researched the scientific evidence and said, it's a bonus, let's do it, let's fund it. But this government wants the tail wagging the dog. The bureaucracy that they keep developing and growing, as we see with Bill 41 today, is hurting patients across this province. It's time for a change, Mr. Speaker. This government's waste, mismanagement in this province is becoming so rationed that kids like Aidan, another one, Balin, who has the same problem, their health outcomes rely solely on the generosity of others. Speaker, the province has been studying this issue since 2011. How many years did it take to realize this treatment is critical for suffering families? Mr. Speaker, when will the minister act? When will the minister listen to other provinces across this country, fund the treatment, and give kids their eyesight?
Thank you. Minister.
Mr. Speaker, and I believe that Ontario patients are best served when we make our decisions based on science and based on evidence, when we follow the explicit direction of a technical, scientific, clinical expert committee that has guided us in this particular procedure, which is one of a number of procedures, Mr. Speaker, that are available. I know that the member opposite would like to fund anything that comes before him. We have a process. We've taken the politics out of the process. It's clear to me that that party would bring the politics back in, and instead of allowing clinicians, scientists, experts, technical committees established to make these difficult decisions, instead of allowing that process to take place, it's clear that the member opposite in his party would make these decisions based on politics alone.